Hi, my name is Victoria Okine, and this is a presentation over sedatives and hypnotics. I'm going to be focusing on short-term, long-term, and side effects, and also prevention methods. So basically, sedatives and hypnotics are known to be antidepressants, and what they do are they increase the serotonin levels in the brain, which slows down the brain activity, causing drowsiness, and it promotes like a calming, relaxing effect. Some short-term effects because of that are drowsiness, slurred speech, poor concentration, confusion, dizziness, problems with movement and memory, lowered blood pressure, slowed breathing, and for disorders like depression and insomnia, they can be treated with short-term doses. Some long-term effects. Basically, sedatives and hypnotics have a high dependency, and that means that you would have to increase your dosage and increase the frequency that you take the dosage to achieve the normal therapeutic effects that you would if you took it at the required dosage, and this is what makes it highly addictive. Also, continued long-term usage of sedatives, it can cause dependency and withdrawal issues if you try to reduce your dosage or if you just try to completely stop. This results in a rebound effect because the brain slowed activity from the long-term usage has the brain jerking because it's trying to regain its normal pattern and is making a jerking, which can cause anxiety, tremors, and worst case scenario, it can cause seizures. So, some side effects. Everyone will experience side effects when they take any kind of drug, especially antidepressants, but these people have a higher chance for worsened effects. In older adults and kids, it can cause risk for falls, bone loss, and fractures. In pregnant women, it can cause short-term withdrawal symptoms in newborns like tremors, respiratory problems, things of that sort. In teens and adolescents, it may increase suicide rates. So antidepressants are known to, um, temporarily treat depression and things that can lead towards suicide. And but long-term usage, it can increase and have a reverse effect because of all the different side effects that come along with it. And most times, it doesn't completely treat the depression. It does come back. So, in people with bipolar disorder, it may worsen or cause manic episodes. So, some prevention methods are to take the required dosage given by a doctor or your healthcare provider. By taking the required dosage, you can get treated for whatever you're trying to treat at the right time frame instead of increasing your dosage or taking it too frequently and becoming highly addicted to the antidepressant. Also, by not mixing it with other drugs or medications, do not mix your antidepressant with alcohol or with marijuana or any other herbal products to make sure that you don't bring out side effects that the antidepressant wouldn't normally bring out, or to make sure that you don't have any heightened effects from the synergistic interactions. Also, by trying natural ways, by using B vitamins, zinc, etc., by using self therapy, this can help you because you're not only relying on the antidepressant and you're also trying to find other methods to cure your depressive ways. Also, take note of any side effects and possible symptoms. Basically, if you have bad side effects, or if you have increased suicidal thoughts or anything like that, make sure you take note of it because every antidepressant doesn't work the same for everyone, and it takes time to find the right antidepressant for you. Also, by taking note of any possible symptoms. Basically, within symptoms of antidepressants, if you're craving it just on the daily, like you want to just take the medication. Also, if you're becoming to have physical dependence on it, where you feel like you can't be yourself or you can't be normal without having to take the antidepressant. And lastly, if you feel like you have to take it and it's not within any drug related reason to take the antidepressant. So these are some prevention methods, and if any of these are at the point where you feel like you need to seek medical help, then you should, because you don't want to be physically dependent on antidepressants because they do have harming side effects if you do use them long term. And here are my references.